Dr. Jason Kerr, our guest, he is a rheumatologist. He's president of the BC Society of Rheumatology, and you fear that many rheumatologists, you don't fear, you know, that in 10 years we're going to have a shortage or a looming shortage of rheumatologists.
Yeah, we did a study for the first time. You know, we're a very small group and we're not in hospitals that much anymore because our patients don't get admitted, but we wanted to have a look at what's really happening with the delivery of rheumatologic care in the province. And we found that there are only 32 full-time practicing rheumatologists in the province for a population of almost 5 million, which falls well below recommended standards around the world for rheumatologists. If you think that rheumatoid arthritis is about 1 in 100, that's probably about 50,000 people in BC that have rheumatoid arthritis. And there's only about 30 of us working to see those patients. So if you throw in all the other autoimmune diseases that we need to see as well, it's going to be a challenge. And then we have a lot of people retiring coming up as well.
Okay,
so.
And as we age, do we get more autoimmune disease or less, or does aging have anything to do with it?
Aging certainly has an impact on arthritis, on osteoarthritis, and there are some diseases that do present in people later on in life. So we do see late onset rheumatoid arthritis. We do see conditions like polymyalgia rheumatica, which is an inflamed stiffness condition that presents in people over 60. So.
Really? You have to be a linguist to be a rheumatologist.
Yeah, it's true.
I was looking at all the things you could possibly have. I can't pronounce most of them, but it's degenerative, it's inflammatory. Now the alternative medical people tell me gluten-free diet, like if you have lupus or whatever you have, it's not going to cure it, but go gluten-free or eat low in the glycemic index. More fruits and vegetables.
I tell all my patients to, a lot of it is common sense. I think if you do find that there are food triggers that make your joints feel worse, you should avoid those. But that's so individualized. I think everybody has a different experience with those.
What about the weather?
Well, weather. I know everybody talks about the weather. I think regardless of what type of arthritis you have, whether you have wear and tear arthritis, osteoarthritis, or you have rheumatoid, or you have gout, the weather, the humidity, the rain, those sorts of things seem to have an impact on people's joints.
And they have a pill for gout now, apparently.
We have great treatments for gout.
You have a pill.
Yeah. Gout is something that it should be fairly manageable for most people, and we do have great new treatments. And gout was kind of a forgotten disease over the past 50 years, and for the first time in 50 years, there were 2 new medications approved in the U.S. for gout just the last year. So again, it was a field that was kind of forgotten about, and now all of a sudden we have more options for people that have bad gout, and there are some people that genetically get gout more so than others.
Really? And can it just go away?
Gout tends to come in flares, but often related to things that are also going on in lifestyle in terms of diet and alcohol. And
someone said that if you eat a lot of meat, a lot of red meat, alcohol, and fat,
absolutely,
it may trigger it.
It's the disease of kings, right? That's where it comes from.
My friend swears cherry juice, organic cherry juice, helps. I have no idea.
I've had many patients mention the cherry juice. So,
well, everybody has a theory, and why not? I mean, if you're in that kind of pain, try whatever, as long as it's safe.
Every bit helps.
Of course, what's lupus?
Lupus, I think lupus is probably the most amazing disease in medicine, and many of my mentors over the years had said, if you understand lupus, you understand medicine, because lupus is one of these autoimmune diseases that can affect anything in the body. It is traditionally a disease of women, very young women. Children can get it, but typically it's women between 20 and 30 usually when they get diagnosed. And the same sort of concept of inflammation and the body attacking itself happens on the skin, in the joints, in the lungs, often the kidneys.
Really?
And people can get very, very sick with lupus. It's one of the conditions in rheumatology that people can die from. So we get very concerned about lupus. And it is a chronic condition, much like diabetes or heart disease, and we have to, they have to have a good relationship with their rheumatologist and put in place plans to help manage whatever manifestations that they're.
What are the early warning signs?
Skin rash. Women with lupus often get various rashes when they're quite young, and often very photosensitive, so they go out in the sun and they break out in rashes. Blisters, things like that.
Like a heat rash or a different kind of rash?
It's much more severe than a heat rash. Yeah, it's often raised red lesions that come out in the sun. So rash is one of the earlier signs, and you can get things like hair loss and mouth sores and a lot of other kind of milder symptoms that lead to the diagnosis.
And the connection between the skin and what's going on inside is so weird.
Yeah, well, the skin is an
Maybe
organ.
not to you.
The skin is an organ like the others, and so if you can have inflammation, in your lungs, in your kidneys, you can have it with your skin too.
I'm sure.
Yeah.
But it just seems,
Yeah.
and I don't want everybody to panic if they get a rash.
Yeah,
They
yeah.
think they have lupus. Do you know how you can do that? You
Yeah.
go, oh my gosh, I've
We all
got
do
a
that,
rash.
yeah.
I'm on my way.
Yeah. When we go through medical school, we all self-diagnose ourselves with every condition that we read about.
Of course you do.
So,
Of
yeah.
course you
Yeah.
do. So obviously you're having some fun doing this. I was in Vernon at the Sparkling Resort recently. They have a cold sauna. And people who have arthritis come there and have like 10, 20 treatments. The Japanese apparently invented it. And then it went to Russia, the only one in North America. And they say it does not cure arthritis, but people can be pain-free for 9 months at a time.
Yeah, it sounds like it would be fun to
No
try.
kidding.
Yeah,
well, they're putting them apparently in hospitals in Europe.
Yeah. There's definitely a much more...
Maybe at VGH.
There's definitely a much more physical therapy side of tradition of treatment of rheumatologic diseases in Europe that goes back longer than what we have in North America.
What about baths, things like that?
Yeah.
Like, the hot springs. Is there a hot-cold treatment
Well, I think
that works? Or
again, it depends the type of arthritis. The patients with rheumatoid arthritis or inflammatory diseases often feel better with heat because heat warms up their joints. They get a profound morning stiffness. So they wake up in the morning and their hands are really tight, and it takes them an hour or 2 hours just to get that stiffness out of their hands.
Yeah.
And so those patients often find that heat is much, much better for them than cold.
Sure. Well, what's the difference between a patient who might have one knuckle that hurts and somebody who hurts everywhere? What's going on in those two bodies?
Well, again, that's where you have
It's a mystery.
That's where you have to have the diagnosis to figure out what it is, and that's where that's why when you see a rheumatologist, often your visit takes up to an hour for the first time because it's complicated to sort through what the symptoms of the joints are, what is the pattern of arthritis, and then it's a detailed physical exam to figure out which joints are involved, and then we also have to review the lab tests in terms of what's been ordered and what needs to be done before we can put it all together, because they're all clinical diagnoses. There isn't one test for arthritis. It's putting together the story to come up with the diagnosis. So it's different. Having a heart attack, there's a test for having a heart attack. You can prove that. You can do an ECG. You can do a blood test, and Our diseases, you don't know with very simple measures.
Well, it can be very frustrating for the patient because they know they hurt.
Exactly.
And you're trying to figure out why.
Yeah.
Interesting work you do.
Yeah,
Thank
great.
you.
Thank you so much for having me.
Nice to meet you. Dr. Jason Kerr.